Hi, I'm Mick Raich. I'm the president of Vachette Pathology and Snark Medical Auditing. Let me talk to you a little bit about fraud and abuse. Today I'm going to call this the crime beat, okay? I'm going to run through some of these and we'll see what the trends we see and where things are at. Here's an EKRA problem. It looks like they were paying a salesman $30,000 a month to bring in specimens, and it was determined that that wasn't a fair market value. Classic example, EKRA is an interesting angle. You have to make sure you're not incentivizing people to ship specimens to you or to bring specimens in at a rate that's above fair market value. Here's another one. Medical facilities referred excessive and unnecessary testing to a lab and wanted a kickback, and they got a kickback for years. And when the medical facilities, the lab stopped paying a kickback, guess what? All the testing went away. And it was an easy one-to-one correlation. The OIG was able to find that. Here's another one, $845,000 fine. They had a policy at this one lab to test every resident, submit screening and confirmatory tests every week. This is for a detox, for a treatment center. And it was determined that they were testing all these residents, but it wasn't medically necessary. Again, plenty of testing, but no medical necessity behind it. Another one, $357,000 fine. This lab allegedly submitted claims for genetic testing without physician oversight. They just said, hey, we think you need some genetic tests. Here you go. Another one. This is a kickback payment from a third parties for referring individuals to those third parties for services which payment was made in part by the federal healthcare programs. So basically, they paid somebody to send patients to a lab who then did testing, who then built government programs, and that's fraud. That was very obvious, very clean. If you're paying for specimens in any way, shape, and form, you're in trouble. Bad idea. This is an interesting one because they talk about this lab or this LLC did not comply with Medicare billing requirements, and Medicare audited 100 claims, and 46 of those claims that turned out to be fraudulent, and there was an overpayment of $132,000 on those 46 claims. Well, they extrapolated this out, and it came to overpayments to about $3.1 or $3.3 million. So when Medicare does an audit, they take a universe of claims, and they say, whatever we find in this universe, we're going to extrapolate over the next 2 years. Or past 2 years, and then we're going to come to you with that number. And that's exactly what happens here. We see this type of audit is going to be very popular with COVID come next year. You're going to see a lot of people auditing COVID claims to find out if they have medical necessity, if they use the portal correctly, that type of thing. Here is a lab that was caught, and it looks like $1.6 million default judgment because they were, the proprietors of the lab accepted hundreds of thousands of dollars from customers after promising to assist them in establishing eligibility for Medicare coverage, then failing to provide the promised services. So what they said is, hey, come in. We'll get Medicaid for you. We'll do some tests. And what they ended up doing was never getting the patients in Medicaid. So, and they took the patient's money to do that too, on top of it. Terrible idea. Here's the next one. Let's move on down here. A urine drug test lab had to settle self-disclosed charges of falsely billing Medicare for specimen validity tests. While Medicare covers drug testing as part of the medical necessary treatment, it doesn't cover SVTs, which are performed as part of a quality control process to catch drug test cheaters by verifying the urine drug test sample is consistent with the normal human urine and hasn't been altered. This lab was lucky, only $84,000. Again, submitting part of the test that wasn't even supposed to be submitted to Medicare. Not a good ending. Here's a settlement for $4.5 million against a North Carolina lab for diagnostic testing lab. They formerly located in North Carolina. They consented to the entry of final judgment against them for This lab submitted millions of dollars in false claims for reimbursement to the Medicare program in violation of the False Claims Act. It sounds like this $4.5 million judgment for somebody making up claims and just sending them out. That's possible also. They're not very good at being fraudulent. They got caught very easily. These are simple things. Here's another one. Pennsylvania lab was caught. A man admitted his role in conspiracy to receive kickbacks and bribes from Pennsylvania laboratories in exchange for referrals of patient DNA samples and genetic tests. Again, he says, I'll send you the patients, you give me some money, you build a DNA test and genetic tests. These are $6,000, $7,000 tests. They're probably kicking back the guy referring it, a couple $100. You're buying specimens again. Terrible, terrible, bad idea. Well, let's finish up on one. The last one here is, again, genetic testing. It looks like this lab was getting samples from other labs around the nation to do DNA testing and genetic testing. Medicare paid him $4.6 million. And it looks like the lab in itself paid $1.8 million just in bribes. Again, these are big numbers. These are people paying for specimens, paying other labs to send them stuff. Hey, you send it to me and I'll bill it out and I'll kick you back something. These relationships smell bad. Like I say, they don't pass the sniff test. So be aware of this. Keep an eye on these things. If you have questions, talk to your lawyer in your area. It's not worth being in the crime beat for issues in areas of obvious fraud that you're going to get caught. Take a good look. Audit your billing. Make sure your people aren't doing it right. I didn't even mention the times here that, there's a couple of them where people were doing it, billing staff was doing it wrong, and the poor lab owner didn't even know. So pay attention. Pay attention to your pathology billing. Pay attention to your lab billing, your specialty billing. Audit your billing people. Hey, again, I'm Mick Raich. If you have any questions or comments, leave them in the link below or give me a call at the number, and I'll do my best to help you out. Thanks a lot. Bye-bye.